Congresswoman Johnson, welcome back to the program here. You've said nearly 100,000 of your constituents in District 32 rely on the Affordable Care Act. Senate Democrats folded on their demands. What are you hearing now from those constituents?
Well, they're upset. I've heard quite a bit from folks, very, very upset with how this process has handed down. They're very happy that I stood up and fought for health care and that so many of the House has, and that we've really held the line. But now it's time to see what happens in these negotiations in December and see if we're actually going to get something done. If they really, mean what they say and say, yes, we'll address health care then. We're certainly ready to go to the table and keep health care available for so many North Texans.
But at the end of the day, it was Democrats that folded on their demands after standing up for this for so many days here. I mean, do you take any of the blame for it?
Well, I don't. I didn't fold, but I certainly don't agree with the decision that those 8 senators did. They made their own decision for a variety of reasons. I mean, at the end of the day, a lot of folks wanted to get paid, SNAP benefits. We were facing a lot of hunger. Our air traffic control system was about to just become a real hot mess. And so, I certainly understand why they did what they did. But having said that, I think trading off healthcare for millions of people, and especially us in North Texas, was not a deal I was going to make. I thought we could get it all done. I didn't think we have to pick and choose. It wasn't choices. We should have been able to take care of all of it. But Republicans have sold the American people out.
Do you think that Democrats will pay a price for this next year?
I don't think so. I think what we've done is really elevate and highlight the difference between the party structure. Democrats have been fighting hard for health care, and what the American people learned really quickly is that Republicans are willing to sell them down the river and that they're not interested in making sure they have health care. The Republicans put a bill forth that cuts Medicaid, cuts billions of people off of the health system in the state and in the country. And so, people know, if you look at the polling on it, overwhelmingly, the American people trust Democrats on health care. The Republicans have fallen like 20 points on this issue. Trump's approval rating is in the toilet. They are really struggling for what they've done to the American people.
But for clarity, it doesn't actually cut people out of health care. It just reduces the subsidies, which means that you and I will pay more if we're on the marketplace. Is that right?
Yeah, but if it's unaffordable, if it's unattainable, if it takes, I have constituents that their health insurance is going to almost quadruple, making $80,000 and their health insurance premiums are almost 25. That's essentially cutting it because they can't afford that. It's just not even a possible option for them. So, yeah, I think that, these subsidies really helped folks, small business. And remember, to be very clear, this is small business owners. These are people who have independent companies. These are people who don't work for large companies. We really need to take a step back and look at a lot of issues on healthcare. And I'm hoping to be part of that discussion over the course of the next year. We have a lot of policy ideas to help bring transparency and prices down. And we really need to have a robust conversation and really have people who are really serious about solving the problem. But cutting people off their healthcare in the interim isn't the answer.
So this new short-term funding that has been agreed to only carries the government through what I think January 30th of 2026, 8 weeks or so, 10 weeks or so from right now. Why can't why can't Congress agree on any longer term funding?
I wish we could. I am so willing and ready to sit down and have a long-term solution. But at the end of the day, Republicans are in control of the calendar. I don't have the ability as a Democrat in the minority party to bring a bill up to the floor. Only the Republican Party does. And they have not passed the appropriations bills. We've had a process. They've been in charge this whole time. Yeah. They could have very easily gone through the process and passed a robust appropriations and really or teed up a series of healthcare initiatives. I have a prior authorization bill I filed. They could do all sorts of things, but they're not bringing it to the floor. So this is squarely at the feet of the Republicans lacking leadership to get healthcare solved in this country.
Let me go back to healthcare for a moment here. The Senate agreed to hold a vote on whether to extend those healthcare subsidies. Speaker Johnson in the House has not made that same commitment to do that. Do you expect that the House is going to vote on the same issue?
Well, I hope if something passes in the Senate, that yes, it'll come into the House. The American people clearly want something. The polling on this is just in the low 80s of people who really want Congress to deal with this issue. And so this is not a Democrat issue. This is an American issue. constituents of Republican members of Congress want them to solve health care. And so, this is something that it is our responsibility to do as elected leaders in this country. And I really hope that we can get it done. I'm certainly willing to be at the table, and we'll meet with anyone, Republican, Democrat, Independent, whoever, to have a conversation to see if we can solve this problem.
Like so many Texans, I know you're awaiting a decision from that federal court in El Paso about whether the Republican redrawn congressional districts are going to stand or not. Do you expect that's going to happen before the filing deadline ends in December 8th?
Well, Lord knows I hope so. We all would like to have it. Otherwise, it seems kind of for naught. The trial court's very aware of the filing deadlines in Texas, and they do have the ability to adjust those. And that's probably at this point, given the lateness of their opinion, we expect that to happen, that they will extend the filing period some point of time to accommodate for the lateness of their opinion. That's what happened the last time this happened. They issued an opinion in right before Thanksgiving. They extended the filing, and they actually moved the primary. I hope it doesn't get to that. I hope we can keep the primary the way it stands. It just makes it so much more expensive for the taxpayers of Texas to have multiple primaries like that. So I really hope we can keep it on the same day. But I'm anticipating, hopefully, a ruling any minute. It should come out. They need to get it out.
One last question. You and I haven't spoken since New York voters elected Mamdani as mayor, and now Katie Wilson has been elected, it seems, as mayor of Seattle. She is a self-described socialist. I'm curious if you think, based on these two high-profile races, whether your party is drifting further to the left.
No, I think what you see is our party is opening up. Look, because we have Mikey Sherrill and Abigail Spanberger, two very much more moderate Democrats on the spectrum that were also elected. I think what you're seeing is the Democrats have a big tent, and we are resonating on a clear message of affordability for Americans. People are really having a hard time out there, and everything is going up. And when you have the president saying costs are going down, when everybody knows that they have less money at the end of the table, they realize that that is just false promises, and that they're very disillusioned, and they want somebody who's going to solve this affordability problem. Democrats, we have a lot of folks, we have a lot of ideas. We don't agree on all of it, but we do agree on is that we need to advocate for the working people in this country, and that's what we're doing.
Congresswoman, it's good to see you. Thank you for the time.
Always good to see you, Jason.